Okay, so let's dive into this pretty intense topic today, reanimation. We've got a bunch of sources on trying to, well, bring someone back.
Yeah, it sounds dramatic, and it is. Our sources really ground it in what happens medically. It all starts when the heart just stops pumping. That's cardiac arrest.
Right, and bam, everything shuts down, no pulse, blood pressure gone, and the big one, no oxygen getting around the body. The sources call this clinical death.
Exactly. Clinical death.
Yeah.
That initial window where potentially it's not permanent, maybe reversible.
What really jumps out is how fast it all goes downhill, especially for the brain, which needs that oxygen constantly.
Yeah.
Lose consciousness in, what, 5 to 15 seconds?
Unbelievably fast. Yeah, 5 to 15 seconds. Then breathing stops, or you just get those awful gasping breaths within maybe 15 to 30 seconds.
And the pupils widen pretty quickly, too, like 45 to 90 seconds in.
Wow, that timeline is everything. The sources really hammer home that after about 3 minutes without oxygen, you're looking at likely irreversible brain damage. It's incredibly urgent.
So if you're there, how do you even know? What are the dead giveaways, according to the sources?
They keep it simple for that first look, basically. Unconsciousness and no normal breathing. And that includes gasping, that's not normal breathing.
So if you see that, or even if you just suspect it,
You start. The advice is clear. When in doubt, start reanimation. Don't wait.
and that starts with basic life support, BLS, which is essentially stepping in for the body, right? Breathing for them, pumping for them.
Precisely. Ventilation for breathing, chest compressions for the heart. And the sources are really, really clear. Those chest compressions are job number one
Why so critical?
because they create some blood flow, even if it's minimal, just enough, hopefully, to get a bit of oxygen to the brain and the heart muscle itself.
And that's why stopping is so bad. I saw that in the sources. Pausing compressions just kills that tiny pressure you built up.
Exactly. You lose it immediately. Got to keep that rhythm going. The standard cycle they describe for adults is 30 compressions, then 2 breaths. 30.2.
And the technique sounds specific. Push hard, push fast, at least 5-6 centimeters deep for an adult, center of the chest.
Yep, lower half of the sternum, and fast 100 to 120 times a minute. And crucially, let the chest come all the way back up between pushes. That recoil is vital for the heart to refill a bit.
Okay, and the breaths. Make sure the airway's open, head tilt, chin lift.
Right. And if you have a bag mask, use it, ideally with oxygen. But the key is gentle breaths. Just enough air, maybe 500, 600 milliliters to see the chest start to rise. Not big puffs.
Why not?
Big risk of forcing air into the stomach. That's a major complication you want to avoid.
Got it. Okay, beyond compressions and breaths, there's defibrillation. Analyzing the heart rhythm seems key.
Hugely key, because some rhythms, like ventricular fibrillation VF or pulseless VT, you can actually shock them back into a more normal pattern. And these are super common causes, like 75–90% of arrests outside hospitals.
And shocking early makes a massive difference. Survival drops like 10–12% every minute you wait.
It's a terrifying statistic, isn't it? That delay is just devastating. AEDs, the automated ones you see around, they're built for exactly this. They analyze and tell you if a shock is needed.
But safety first, right? Make sure nobody's touching the person.
Absolutely critical. Clear everyone before the analysis and especially before the shock.
So that's BLS. The sources also nod to advanced life support, ALS. More complex stuff.
Yeah, things like advanced airways, getting IV lines in for drugs like adrenaline, and importantly, trying to figure out why the arrest happened, looking for reversible causes.
Reversible causes,
Right.
like the 4-H's and HIDs they mentioned. Things you could potentially fix.
Exactly. Things like low oxygen, hypoxia, low body temp, hypothermia, electrolyte problems, or even things like toxins, blood clots. If you find one and can treat it, you might actually reverse the whole situation.
We should also quickly mention kids. It's different for them, the sources say.
Definitely. Often it's a breathing problem that leads to the arrest in kids, not a primary heart issue. So you usually start with 5 rescue breaths for them.
And the compression ratio is different too, 15.2 often. And lighter compressions.
Right, about 1/3 the depth of their chest. It varies by age, but the principles are adapted.
So wrapping it up, the core message from all these sources seems to be recognize it fast, push hard and fast on the chest, breathe for them, and get that defibrillator on ASAP if you can.
That's pretty much it. Those basic steps, done early and well, make all the difference in those first few minutes. Knowing this stuff, even the basics, can genuinely save a life.
And it leaves you with that thought, doesn't it, about those reversible causes?
Yeah, that someone can be clinically dead, heart stopped, but if you find the reason, maybe it was low oxygen, maybe a drug effect, and you fix that, they can potentially come back fully. What does that really tell us about where the line is? It's something to think about.